And we are live. It's at the J in the house. I'm here with Rob Edwards today from Heritage Health Life. We're going to be chatting here today about estrogen dominance and how to detoxify estrogen. We'll make this podcast applicable to both male and female, as obviously there's going to be different, from a fertility standpoint. Estrogen is important, but also the balance of estrogen and progesterone is also important. And with men, too much estrogen causes lots of issues. So we'll dive into that topic. How are we doing today, Rob?
Doing great. Doing great. It's good to
Excellent.
be on again.
Awesome, brother. All right,
We're
let's
ready.
dive in. Let's dive in. So, why don't you just kind of open us up here? What is estrogen dominance out of the gate?
Yeah, estrogen dominance isn't so much the idea of sort of just estrogen being high per se. It's a ratio between progesterone and estrogen itself. And so estrogen dominance, it has an opportunity to sort of overtake or overplay its cards whenever it's too high related to the progesterone. Estrogen comes in at sort of the beginning of the building phase of the uterine wall in one cycle, and then progesterone comes in, and either it carries a child to term and it sort of stabilizes the uterine wall, or it drops and it eliminates, and that's whenever it go through a cycle. But estrogen dominance is a very big topic with I think the majority of the patients that we see that are female, especially. But to your point, Justin, we have a lot of males as well with estrogen dominant signs and symptoms as well.
Yeah, I'm going to show up a image. I'm going to put an image here on screen to kind of help you guys out. Just pull that up. And this will hopefully make a little bit more sense of what's going on here. All right. So first off, we're going to just show a female cycle out of the gate just because it'll make a little bit more sense from that standpoint, because women are a lot more technical than men when it comes to their hormones. Like male hormones, like testosterone is just kind of a foghorn like this. And you can see the intricacy of female hormones are a lot more. Now, of course, estrogen's going to come in not in a pulsatile fashion with men. It's going to come in via plastics. It's going to come in via pesticides. It's going to come in via hygiene products. It's going to come in via scents and fragrances. Think the little trees in your car. Think the Glade plug-in. Think the Febreze. Think the plastics. Think the pesticides. Think the soy or the Impossible Burger, right? You're thinking like, oh, I'm helping myself by not eating meat. No, you're actually hurting your hormones. So these are big ways that men are going to interplay with this. Now, those same things can also impact women, but it's a little bit different. So we look at a female cycle out of the gate. Essentially, hormones end here at the end of a cycle, and this triggers menstrual flow, and then the cycle restarts. And so you can see here, hormonally, FSH, this little green guy starts here first. That's follicular stimulating hormone or follicle stimulating hormone. That causes the egg in the ovary to grow and mature. Then from there, estrogen starts to peak up. You see the light blue here. Okay. And now that follicle has maturized or matured enough where estrogen's now coming. And then you're going to see here, LH then starts to trigger right after that. You can see that little yellow here. And then after that, then progesterone starts to kick in. So it's a domino rally. It's going to be first FSH, then it's going to be estrogen or estradiol, then it will be LH, right? That's going to be luteinizing hormone. That then talks to that same follicle area, or that corpus luteum area now, to make progesterone. And that progesterone starts to peak up over here. And women also have testosterone kind of peak too. It happens right at ovulation. That makes sense because that testosterone is creating that urge to have intercourse, right? That's how you get pregnant. And so that testosterone also peaks here. You can't quite see it, but there's a peak of testosterone there too. And then we have progesterone here. So what tends to happen over time is this estrogen over here, this blue, can start to come up sooner or start to bounce around. And then over here on the backside, it can also stay up high, or it may stay exactly the same, but then now this progesterone over here actually starts to drop down. So yes, number one, when we talk about estrogen dominance, can there be elevated levels of progesterone? Sure. Elevated levels of estrogen? Yes, it can be. But number two, can there also be a balance issue where progesterone is dropping over time, and now it's more of a ratio issue? So you can have one, just elevated estrogen. That's possible. And then number two, you can have that ratio of estrogen to progesterone off because progesterone is dropping. Now, why is progesterone dropping? So we can see here, imagine this starting to drop out. It's dropping because of typical stress and inflammation. All right, stress and inflammation, progesterone can pinch hit for cortisol, which can become a stress hormone. So progesterone is a progestational hormone. It's the sticky glue that allows the egg to implant into the uterine lining and allows it to mature. Now, over time, if that progesterone goes down because of stress and inflammation, now that sticky glue drops. And so now it's harder to get pregnant. But also when that progesterone drops, Now things like mood issues, cramping, breast tenderness, irritability, brain fog, um, you're feeling more anxious at night, right? Harder to sleep. These are all signs of lower progesterone. So we have the fertility side on one, and then we also have the mood stuff in that 1 week or so before menstruation. That's kind of that PMS, premenstrual time frame. Go ahead, Rob.
Yeah, and I think those biological stressors, that can put you into that cortisol dominant pattern, or not cortisol dominance, but high cortisol, or stuck in that sort of fight or flight, like Justin is talking about, can send you into a situation where your progesterone is pinch hitting uh, for that progesterone, leaving that dominance high. So then you're going to have those estrogenic symptoms like he's talking about, the PMS, or irregularity in your moods, or neurological brain fog, or heavy periods, fibroids, like the overgrowth, like with Emily, for example, my wife. The overgrowth pattern, the estrogen's too high. It's a growth hormone. So she was overgrowing too much inside of her uterine wall, eventually created a fibroid, which a lot of people, I think your wife also had a fibroid that she was dealing with.
Yep.
And we have all kinds of estrogenic problems because it's a growth hormone and there's not balance. And that's the issue. We just don't have balance. And so that's kind of what we're getting at when we're talking about the estrogen dominance, and then the kind of downstream symptoms that we'd be looking for in people.
100%. And so when we look at estrogen, right, we want healthy levels. So I'm going to just kind of pull up a little chart here if I can. This is kind of my little notes here of today's video, just to keep me on track. I'm going to pull that up here if you don't mind, and we'll hit that up. But one of the first things we want to look at is why estrogen's high. All right. And so we kind of have natural levels that we want to look at in regards to estrogen. I'm going to pull up kind of some of the functional lab ranges that we may look at just for the references, and you guys can kind of look back at that later. But a couple things I want to highlight is you're going to see here, estrogen is going to start to increase right in that first couple of days. That's where you see that 20 to 50 PG per ml. And you're going to see it really tops out right at ovulation. So this kind of lines up with the graph that we saw, right? Estrogen's going up. It's going up. Now we're around day 13, 14. Now go look at progesterone, right? Pretty low early on in the cycle. Pretty low early on, even mid-follicular. Now we're day 7, 8, 9. Now ovulation, right? It's starting to increase a little bit. And then now we have that peak 7 days post-ovulation, like around day 20. So you can see how these hormones, they're almost out of sync by like 7 to 10 days, right? There's this out of sync by 7 to 10. And this is important. So if we start to add too much, or these hormones start bouncing around, or we drop low on the progesterone side, that can create lots and lots of symptoms. So now, go ahead. Any comments on that, Rob?
Well, I just think kind of the idea behind these are all signaling patterns, and I think it's just to kind of pull the curtain back a little bit. It's a signaling pattern to your body in terms of where it needs to regulate estrogen or progesterone as a whole. And kind of just earlier, what you were talking about, all the other influences that go into sort of messing that whole thing up, whether it's the estrogen side, which tends to be the dominant side. It tends to always be an estrogenic issue because of that. But no, I think those numbers are super helpful to look at, especially if you're going to be doing testing. Because if you're doing testing and you're looking for your numbers, they're going to be different depending on what time or where you're at in your cycle in terms of what we're looking for numbers.
100%. And I want to just kind of show what this is doing to a female side, to a female kind of uterus, just to make more sense of it. I'll pull this up here for you guys to see. Okay, here we go. All right, so this is like your normal endometrium, right? So endometrium is just the uterine lining, right? Endometriosis is this uterine lining starting to grow in areas it doesn't belong. So imagine if this uterine lining started to grow on the outside here, or let's say it started to grow. Let's say this is like in the vaginal canal, or let's say like the bladder behind here, or the colon behind here. That's endometriosis. Okay, so just FYI. So endometrium is normally grown here, and so we have hyperplasia. That just means the cells are starting to replicate, starting to thicken. That's good, right? Because this becomes the area where that egg can implant. We want a nice thicker lining. The egg implants, the progesterone is now the sticky glue that allows the egg to kind of hang out. And then if the female becomes pregnant, guess what? Now the corpus luteum takes over, HCG increases, and now boom, that sticks in and starts to implant and starts to grow. If not, guess what? You have a period and you slough off all this uterine lining and you start all over again. One of the biggest things I see with my patients is when there's hormones are out of balance, we start to slough off old uterine lining that didn't come off from previous cycles. So one of the first things my females will tell me is I'm starting to notice a lot of brown oxidized blood flow during my period. And then over time in future months, that tissue becomes brighter and redder. And the reason why is because the hormones were not in balance. We didn't have that nice, good hormonal drop. We weren't fully sloughing off that whole uterine lining. So we were getting old tissue off that didn't come off in previous cycles. And what that meant was that old tissue sat there, it hung out longer, and it became oxidized, like cutting an apple on a counter. The longer it sits there, it becomes brown, right? Think of an avocado. And so the healthier hormones become, that nice punctuated drop in estrogen and progesterone, we slough off that uterine lining before it's oxidized for weeks and months, and we get a nice brighter, redder uterine tissue coming out or blood flow coming out. So as females, listen, if you see that kind of older blood flow, think about what that means. That just means your hormones are not in a place to really slough that uterine lining off. And as you get healthier, we're going to see that blood get brighter and more red over time.
Yeah, I mean, that makes a lot of sense. I think that's something that we kind of dealt with as well, even on our side is, with my wife, is it sort of, we had to go through those cycles where she was eliminating some of the longer kind of cycles that just didn't eliminate everything, partially because she had the fibroid. I think that's what was kind of getting in the way there from the overgrowth.
And when it comes to fibroids, like my wife, we had a fibroid removed for her. Now, it just came down to the fact that was impairing pregnancy, because imagine that uterine. So let me just kind of show what a fibroid is real fast so you guys can see. I'll pull up that image again. Okay, so fibroid is the most common benign tumor there is. So imagine a growth here in the endometrial. It could be, let's say, in the endometrial lining, right? Or it could be even in the middle of the endometrial muscle. That could also be known as adenomyosis, or it could be on the outside, right? And so this is just a benign tumor growth. And when that's in there, it's pulling lots of blood to drive that growth. And so imagine if an egg implants, number one, the blood is going into the muscle or into where that fibroid is. So it's now away from where that egg could implant. And then number two, it creates a little bit of inflammation in that area, making it harder for the egg to bond in. And so essentially you can remove fibroids naturally. It just may take years and years and years. And if someone's in a fertility window, it may not make sense, right? It may not be within your fertility plan. And also, there's lots of good surgery techniques that can come in there and non-invasively remove it. Where like kind of 20, 30 years ago, the OB would typically just remove the whole entire uterus and do a hysterectomy. And now there's more minimally invasive techniques that make it a lot more economical in regards to time and waiting. And also, if you have a fibroid that's just driving anemia and driving low iron, that can create lots of symptoms. So it just depends where you're at. I always recommend trying to get to the root cause. Even if you remove it, you're still not fixing the hormonal imbalance that drove it in the first place. So we always want to make sure we're still getting to the root cause.
Yeah, and I think that's the importance of doing like a good workup. Like anybody that's got kind of irregularities. I mean, Emily started with the irregularities. Her hemoglobin was super low, and that was sort of one of the big hints for us because we already knew that she was bleeding a lot. From a month-to-month perspective, and we knew that she was high estrogen. Her estrogen was dominant.
Correct.
And so it sort of put the pieces together to help us to understand what was actually going on until we finally figured out that's what it was. But I think there's a lot of different things that the estrogen dominance creates inside of the female body, whether it's breast tissue, whether it's uterine, whether it's fibroid, whether it's endometriosis, whether it's PCOS. I mean, there's so many things that estrogen dominance drives for women, and and they feel crazy. They're not sure exactly what they should do, and they don't even know where to start.
100%. Now, one of the first things we look at is the estrobolome, essentially the microbiome when it comes to estrogen. So research is starting to talk more about it. The estrobolome, estrobolome, estrobolome. This has a lot to do with dysbiotic bacteria in the gut and things like beta-glucuronidase and bad bacteria that we see in SIBO or H. pylori that can impact this enzyme called beta-glucuronidase. So beta-glucuronidase is an enzyme in the intestinal tract that deconjugates estrogen. So conjugation is we have this estrogen. We conjugate it by binding a protein. Usually they're from phase 2 detoxification. And that protein binds to it and then escorts it out either via the stool or via urine. So that's how we detoxify. And so when we have beta-glucuronidase, that protein that comes in and it deconjugates, it pulls that protein off, and it allows that estrogen to go back into general circulation. So this also impacts men too, because part of why men may have high estrogen, gut bacteria plays a big role. And so dysbiosis, bad bacteria, low fiber diets, not eating enough good, healthy vegetables, or even vegetables that are higher in cruciferous. Think your cauliflower, think your cabbage, think your Brussels sprouts. Now, if you have a lot of dysbiotic bacteria, those foods are also very high in FODMAP. So those foods may also bloat you too. And this is where there's a double-edged sword where it's not maybe not that simple. We may have to go in and actually work on killing microbes, maybe even doing different therapeutic diet changes like a paleo lower FODMAP diet for a period of time. It's not that, I wish it was that simple. So depending on how bad the gut is, that can significantly impact detoxification on the hormones. And it can just take this estrogen and recirculate it. And then also, what if we're constipated? What if we're not moving our bowels and moving, let's say, 12 inches of stools within 18 to 24 hours? That's also a sign that we could be reabsorbing a lot of toxins as well.
Yeah, 100%. I think that's the beta glucuronidase conversation. You can see those markers if you're testing for them, and you see that they're kind of high, which is going to allude to based off of signs and symptoms that people come into the clinic with, of how we're going to actually put together the pieces of the puzzle. And to your point, I think a lot of people think I can just switch my diet and I'm going to be all right. And you put somebody on a keto diet, they get the keto flu. You put somebody on cruciferous vegetables, they can't handle that either. And it's a whole it's kind of a whole, it's a little bit of a puzzle with every person that comes in terms of what their body can handle just naturally, then adding on top of that supplementation. And it can take months and months just to figure out the body in terms of how we need to get things in place and in position to be able to do the next thing therapeutically.
100%. Now, the gut plays a major role in male and female. So I always tell my patients out of the gate, are you digesting your food well? Are you moving at least 12 inches of stool? How's your stools looking in the toilet? Do you see a bunch of, is it really loose, like a Bristol stool chart 6 or 7, soft serve loose, or is it really pebbly at that 1-2 side of the Bristol stool chart, right? Just go to Google image Bristol stool chart and you'll kind of get a sense of what that looks like. I'll try to pull it up here on screen if I can in a minute. But in general, we want to make sure good digestion. So the easy things we can do there is hydrochloric acid and enzymes. There could be more stuff happening. So like low-hanging fruit is just chew your food really well. Don't overly hydrate when you're eating, because water's got a pH of 7. Your stomach's got to have a pH of 2. And if you add a whole bunch of 7, you're going to take that 2 that's acidic, which is good. We want acidic, and it raises it up into a more neutral to alkaline range, which then shuts down digestion. Make sure you're chewing your food well. Again, if you don't chew your food well, the acid and enzymes have less surface area to work. So the more we chew it up, the more we break it up, the more we can bind to it. Now, most people don't think about how the gut and digestion and food chewing and hydration and just being able to digest your foods, especially your proteins, because your proteins are going to be the major amino acids that run our phase 2 cytochrome P450 oxidase pathways. Those pathways involve N-acetylation, sulfation, glutathione conjugation. Typically, it's going to be our amino acids that run that. Methionine, cysteine, glutamine, glycine, taurine, those are all going to involve amino acids. So if we have crummy digestion and we're not breaking down those amino acids, that phase 2 cytochrome P450 pathway is not going to be working well. So we got to make sure that is dialed in.
Yeah, and I think also like taking into consideration into food choices just in general, causing more inflammation in the body with things like glutens or sugars or things of that nature, that is also going to drive gut dysbiosis, which is going to interfere with estrobolome as well, and how we're conjugating the estrogen metabolites that we're actually needing to deal with. And so with a lot of people, it's sort of like, where is your food relationship currently at? And they get afraid sometimes of going through a process of eliminating certain foods. But it's not about an elimination of foods. It's about learning how to have a healthy relationship with food and to maximize your body's potential with the foods that you're eating, and chewing them up, actually choosing to eat proteins. A lot of people that are vegetarian, for example, struggle with that. And that can become a problem too.
Correct. Now, I'll just put it on screen here just so everyone can see. All right. So this is our Bristol stool chart right here. So you can see type 1. This is kind of like more rabbit pellets. This is going to be more on the constipation side. Type 2, it's obviously becoming less severe. So the big things that are going to they're going to cause this is going to be dehydration, typically less fiber, or not breaking down that fiber. Maybe it's someone that has really poor digestion. They're eating raw vegetables and they can't quite break it down. And then type 3 to type 4 are starting to become more normal. That nice, smooth, kind of sausage snake-like, right? This is like the poopy policeman, if you will. See on my screen here. Let me see if I got it here. Okay. Here's my poopy policeman right on the screen. Look at it every day. So this is our Bristol stool chart 4. Okay. You can see that. And then over here, this is our Bristol stool chart 1 and 2, this guy right here. All right. And then we have, yeah, there we go. So here's our poopy policeman right here. This is our 4. This is our Bristol stool chart kind of 1 and 2 right here. right? And then our 5, it starts to get more liquidy. So this guy right here is going to be our really fast transit time. How do you know? Because it's more green. So the stool starts to get more brown, the healthier the transit time tends to go. So shorter transit time, this is going to be shorter transit time, Bristol stool chart 5. Then this guy right here is our Bristol stool chart 4. See if he's more white, right? This is not breaking down the fat. So this is not enough bile, not enough acid and enzyme. We're not breaking down the fat. And this guy here is our bodybuilder. This is going to be like more protein shakes. So this is still in that Bristol stool chart 5 and 6 category. And then this guy here is the really toxic one. This is someone that has lots of medicines, lots of things that are very toxic or very inflammatory in the stool as well. And then you can see over here, this is kind of nuancing the Bristol stool chart. Okay. And then over here, your 6 and 7 are your diarrhea. And so why does diarrhea happen? The more inflamed the intestinal tract gets, it can typically go one way or the other. But typically, your body's going to pull more water into it when it's very inflammatory to dilute whatever inflammatory compound is in there. It could be a food poisoning thing. It could be something else like that. It could be some kind of an irritant or chemical from the environment that got into your intestinal tract. It's trying to dilute it. Now, the problem with that is it dilutes it. You're not going to absorb the amino acids. You're not going to absorb the fats. You're not going to absorb the electrolytes. And so that can create problems over time with weight or energy or mood or even your electrolytes, creating heart rhythm issues. And dizziness, those kind of things are important. Comments on that, Rob?
Yeah, 100%. I think stool is a big indicator for most things that we actually work on with people, and no different with regards to estrogen dominance. I think anytime you're working with somebody, reevaluating the gut, kind of constructing the gut, eliminating some of the toxins or the overgrowths, or we could be having putrefaction issues, we could be having dysbiosis, parasites, biofilms. Like some of those are the major things that we work with people, just to even clear out the gut in the first place to be able to actually deal with things at an estrogen level. So oftentimes the gut is going to be one of the key players of dysfunction that we're going to look into.
110%. Okay, so last thing I wanted to talk about was blood sugar. Let's go hit that a little bit.
Yeah.
So this is going to be probably one of the bigger things where it comes to men that's going to be impacted. It can definitely impact women too, though. It causes different things. So when we have blood sugar, either we're insulin resistant, our blood sugar is just really high chronically, and we're not getting it down within 2 hours after a meal, that can be a sign of insulin resistance. And with men, it upregulates an enzyme called aromatase. And when that enzyme is high, aromatase, it causes your testosterone to go to estrogen. And so you can actually convert your own healthy male hormones into estrogen. Yep. Now, women, it does something similar, exact opposite. It causes estrogen to go to testosterone. Now, why is that bad? Because testosterone is going to potentially grow cyst in your ovaries. It's probably one of the number one causes of infertility. So you get these cysts, and once you start growing more than one cyst, now that's PCOS, right? Polycystic ovarian syndrome. PCOS. And then those cysts and those androgens can cause increases in prolactin, which start to throw off your cycle. Now your cycle starts to become more irregular, more symptoms, more PMS. Maybe you skip cycles. Now it becomes harder to get pregnant. So both of the sexes have different things that start to happen and different levels of dysfunction based on that insulin. So there's just too much insulin coming in, and that creates insulin resistance. But also there could be just blood sugar is wonky. Like you may have insulin that's pretty decent, but your macros are off, your meal timing's off, maybe you're doing too much fasting, and you got this reactive hypoglycemia spike where you're not like, if I tested you a couple hours later, you're pretty good. But in those first couple of hours, you're bouncing around, you're going high, you're going low. This is called reactive hypoglycemia. It's just because your body comes in, your blood sugar goes up, your insulin and pancreas react to it, and they hyperreact and they lower it too low. Mm-hmm. And then your adrenals have to then bring in cortisol and adrenaline, and then it comes back up, and then you have cravings, and then you repeat the cycle because you're just in this blood sugar roller coaster, and that can create lots of mood issues, and that can also cause insulin and hormonal issues too, but both in male and female. So one of the first things we always talk about when it comes to hormonal health is get your blood sugar in play. The less we lean on our adrenals and our insulin and glucagon to balance our blood sugar out, the healthier we become.
Yeah, I think that's another key feature of the metabolic side of things with blood sugar regulation, because for that exact reason, I mean, for women, for example, one of the least desirable things that they get with PCOS is the facial hair, right? But
Mhm.
they start actually growing that because again, the aromatase on both sides, one or the other. And I think another thing to kind of just illustrate here is, hormones are subservient. So it's like you have your primary hormones and you have your secondary hormones. And your primary hormones is going to be like insulin, cortisol, right? Thyroid hormones. These are your primary hormones. Secondary are sex hormones. And so what I think a lot of people do, and a lot of people that I see, they'll come in and they want to go straight to like hormone replacement therapy, right? They want to solve the downstream issue. Usually, what we're looking at first is blood sugar regulation, like getting normal meal times, like making sure we're not spiking, because when we start to normalize that, a lot of times that corrects all of these other symptoms that are going on.
100%. And so we talked about kind of our detoxification pathways. I mentioned phase two, which is more of the sulfur amino acids. We also have phase one, and that's going to involve, some more of our cruciferous vegetables, the
Mhm.
diindolylmethane, the B vitamins. This is also really important. So the more crummy someone's diet is, or the more standard American it is, that can be a problem because we're just not getting the nutrients to go through phase one to phase two. But also, if we have B vitamins and we're eating good vegetables, but we're not breaking down our protein and assimilating those sulfur amino acids, you can actually start to mobilize toxins or mobilize estrogen. But now it's in your bloodstream, but now you're not able to get it excreted out via phase two
Yeah.
because you don't have that good protein and that good digestion. So we want to make sure we have the nutrients coming in your diet from phase one, but we also want to make sure the proteins are dialed in and you have the ability to break down those proteins.
Phase
That's
two.
where we're getting the hydrochloric acid, the enzymes. We're making sure we have good normal transit time. We're making sure if we have bloating or gas or probiotic imbalancers or SIBO, we're also trying to make sure we address that. I can't tell you how much women or even men have hormonal imbalances and the gut component. That GI component gets missed, especially if you go to a conventional MD.
Yeah.
People with hormonal issues, it's pretty much here's a birth control pill, here's an antidepressant, call it a day. Okay, maybe you have PCOS. Here's metformin. We're not going to talk about how metformin causes B vitamin issues, which then depletes what? The phase one detoxification nutrients. It's like this vicious cycle. Once you
Yeah.
know kind of functional medicine and you can see everything from a root cause perspective, it's just like everything changes, right? And so if you can see it from my eyes, you're like, oh yeah, that's just really a band-aid. And that's going to make the
Yeah.
problem worse over time. And so we want to actually get to the root underlying issue.
Yeah, and it's funny because I've been using that term. Of course, it's sort of like a cliche at this point, a band-aid. I don't even know if it's a band-aid. It's more like a because it actually creates negative effects in the bodies, and band-aids don't do that, right? Band-aids
Correct.
cover
That is
something up.
true.
It's a neutral thing. It's actually worse than a band-aid. I don't
Yeah.
know. I don't even know what to correlate it with, but 100%. So if you're taking some of these medications, right? Number one, yeah, B vitamins are oftentimes an issue, but then two, liver congestion is an issue, right? Which is why for a lot of these medications, you gotta watch your liver. They don't know how congested it's going to get, how far backed up it's going to get in that phase two, phase one. Phase one typically happens easier than phase two. Phase two is where the
Correct.
blockage is usually happening for people.
Correct.
And that's where we're getting recirculation, beta glucuronidation. We're getting this recirculation of toxins or hormones or all of these different kinds of things that our liver just can't do. I mean, it gets congested because there's too much of a workload on it. We've given it too much to do.
Correct. And once you start getting more fat accumulation, let's say insulin resistance starts to happen more, you're accumulating more fat. Now your fat cells actually produce estrogen too. So it becomes a vicious cycle. And so
Yeah.
for my men listening, really simple, focus on the food, focus on blood sugar, focus on the phase one, phase two detoxification. Make sure all the xenoestrogens from pesticides, glyphosate, putting your foods in plastics, hot drinks in
Mhm.
plastics, microwaving foods in plastics, switch to Pyrex, switch to glass, switch to stainless steel. Obviously, not in the microwave for stainless steel for obvious reasons. Use Pyrex. And then same thing for my women too, though. Those are the same lifestyle habits. You're not helping anyone by having soy burgers and the Impossible. That's not good, right? That's not food. That's Franken food. So go to the
Yeah.
healthy, high quality grass fed meat. Remember,
Yeah.
cholesterol is your friend. Your sex hormones are made from a cholesterol backbone. So by eating good, healthy fats and proteins, you're actually supporting your hormones. And now
Yeah.
for my female patients, we're going to have to look at the adrenals. The adrenals play a big role because the more
Yeah.
depleted your hormones get, you may need a little bit of low dose bioidentical HRT. You may need herbs to kind of work on the HPA axis, right? The LH, the FSH, that upstream signaling to work on things. There may be some liver issue. We may have some borderline non-alcoholic fatty liver. We may have our liver enzymes AST, ALT greater than 30. That's possible,
Mhm.
right? We may have some slightly elevated uric acid. These are signs there could be some fatty liver stuff happening. We may have fasting insulin greater than 10. We may have our functional glucose tolerance. Get a blood sugar meter. We may be greater than 100 2 to 3 hours after eating. That's a sign that we may start to have some subtle changes there. And then, of course, we're going to do some lab testing to look at estrogen, maybe in the first couple of days of your cycle and definitely in the luteal phase. And same thing with progesterone. We're going to test these things with our guys. As we increase estrogen, here's the problem with estrogen. It decreases the LH feedback loop from the brain. So LH comes from the pituitary, stands for luteinizing hormone. It stimulates the cells of Leydig in the testicles to produce testosterone. And estrogen comes in, if it comes in exogenously, meaning from the outside in, it decreases that LH. And so now you have less internal production because of the external hormones coming in. And so people are like, well, how do I get my testosterone up? The first thing is stop getting bad hormones that are xenoestrogenic from the outside in, because that starts to help improve your LH signaling. And then, of course, work on detoxification. And there's certain herbs we can use to kind of bring that LH back online as well. So it can get a little bit complicated. Comments there, Rob?
Yeah, I mean, absolutely. And then I like to use for in terms of liver support for, and we did this with Emily, for example, is we like to use DIM sometimes. You know, DIM is a great way that's
Diandol methane.
Yep, that'll clear, help to clear phase two process of the liver, and then also we like to use calcium D-glucarate, which is another healthy processor for the gut and the microbiome. So we utilize those two as well. And then we also sometimes will do molecular mimicry in terms of Vitex. Vitex will utilize for heavy, her heavy administration and those kind of things. We did about 1,000 milligrams of that, and that really took care of the job, almost better than what they wanted her to take pharmaceutically.
Oh, 100%. And so when it comes to upstream with females, LH is important to be worked on, and that's what Vitex or Chase Tree helps on. But we want to get tested. We want to see where you're at. We want to make sure other hormones that interplay are being worked on and addressed. Also, with women, low adrenal function, low DHEA can also impact female hormones. I can't tell you how many women I see, they're estrogen dominant, but they actually have low estrogen. That happens a lot, where we see low estrogen, but they're still estrogen dominant because progesterone's so low. Or their estrogen's normal, their progesterone's low, but then on the Dutch, we see the 2-methoxy, 2-hydroxy estrogen pathways for clearance are also depleted. We want to be 50% or higher on that, and we're just lower. So we're just not methylating, clearing out the important estrogens. And again, the healthier we methylate, that keeps our estrogen 2 to 4 to 16 in balance. We want to be dominant estrogen 2 versus 4 and 16. Yeah. So we have estrogen metabolites that are downstream. 4 and 16 tend to damage DNA and they're more pro-cancer, where estrogen 2, estradiol, 2-hydroxy tends to be more healthy, proliferative, what we want. And again, it's the nutrients that allow that 2 to happen and that ratio to be more skewed to 2. That's where we see the glycine, the choline, the B vitamins, the folate, the cruciferous, the DIM, right? All of our good sulfur compounds, antioxidants, and our good amino acids. That allows more of that preferential ratio to shift more to the 2, right? 2, too much. We want more 2. We want less 4 and 16.
Yeah. Yeah. And I think I wanted to, I think there's just some important things to note is for a lot of people that I see, and there's a lot of people that we talk to every single year, and you start to notice patterns. And one of the patterns that I notice, a lot of people come in and they've already tried to do a whole bunch of things on their own, and they've seen a lot of different people saying, take this, take that, take whatever, Some people go through detox protocols and they come and they're actually worse than they were before they ever started the detox protocol. And so we're kind of explaining all of this stuff to you guys so that you can understand the concepts and what's going on. But really, even for us, the best way to help somebody to move forward is we have to get some eyes on some data. We have to get some eyes on some data in your history and understand what's going on to really put it together, because a lot of people show up and they've just tried so many different things and they are worse, not better. It's not that they're utilizing things that we wouldn't recommend, but maybe they're taking it at the right time, wrong time. They're not binding correctly. They're not doing things kind of in an order of the body it is at play. And so getting some of these root good workups with a practitioner like Justin or like myself, getting a good workup will help us to create some sort of a starting place that we can track and actually improve over a period of 6 months, maybe even a year for some people, maybe even longer than that. It takes some time to heal from these things naturally.
Really good points. So big things out of the gate. We gave you guys a lot of kind of diet things to think about. We gave you a lot of things to think about in regards to gut and digestion and motility. I think some of the deeper things that have to be looked at is when the gut issues are chronic, where you're having more bloating, more gas, more motility stuff. We want to look under the hood and do some in-depth stool testing. And also, if we have some hormonal imbalances, we also want to run a comprehensive Dutch test. We may even want to run a blood test. We may want to time these up in and around the luteal phase. We may also want to look at DHEA and how the adrenals play in. We may also want to do some functional glucose testing as well. Maybe even looking at insulin. So these are all good things that are on our list, on our mindset of things that we go through with patients. So if you're getting stuck, right, feel free. There'll be links down below in the chat where you can reach out to us both. Okay, Rob is at heritagehealth.life, heritagehealth.life. I'm Dr. J at justinhealth.com. Links down below. If you enjoy the content, love to see a comment below. If you're getting stuck, feel free, reach out to us. Our team and staff will reach out to you and see how we can better help you and if you're a good fit. And also, there's a lot of good information here. So just start applying something. And then if you get stuck down the road, we're here to help. Anything else, Rob?
Yeah, 100%. I think that's a great starting point. Get it started somewhere, as Tony Robbins usually says, right? If you want to get started, today's a good day.
Yeah, exactly. And again, if you've gone to your conventional MD and they just recommended birth control pills or they recommend an antidepressant, there is so much more you can do. I know if that was your recommendation and you feel just kind of lost or totally let down, there are totally good options. And if they told you, hey, this is just aging, this is what it's about, it's not. Okay, there's a lot of other options that we can take and a lot of paths we can take that kind of unlock your body's kind of healing potential.
Yeah, absolutely. Aging is the throwaway. It's the throwaway thing to use whenever I can't figure it out.
It is. Absolutely. It's true. Awesome, Rob. Have a good one. Take care, y'all.